Yeah, and now it's 11 o'clock. I think we have to start because we have a lot to talk about. So as usual, yeah. Uh, like I say, good morning, everyone,
Morning.
and thank you very, very much for joining us on this important meeting. As you all know, I'll be hosting or I'll be sharing today's meeting. Uh, my name is Mr. Usman Gay, the community development worker for Family Voice Peterborough. Yeah, first of all, can I remind you all that we will be recording our today's meeting and can be easily accessed via our YouTube page. So we also realize that 1 hour is not enough to cover our agenda. So therefore, we are thinking of adjusting it from 1 hour to 1 hour 30 minutes. But we need your opinion on that first. Yeah. If you all are happy with that, we can start that from our next meeting. So in today's meeting, we'll be discussing mental well-being for parents, carers during lockdown. Who is that? Laura Simit. Yeah, Laura, welcome. Yeah. So with regards to the impact of the lockdown on mental health, we want to know those who are not affected and those that are partly affected, and there might be some who are affected badly to the extent that they might need a psychiatric to, to help them. So these categories of people need to be differentiated and deal with differently. So in today's meeting, we have our main speaker called Catherine Goose, Senior Commissioning Manager, Children and Young People's Mental Health, Cambridgeshire, Peterborough and Peterborough Clinical Commissioning Group. So after Catherine, the follow will be Francis Thompson from Young Carers Project Center. After that, we will have Sarah from Macmillan Cancer Support. After Sarah, we will have Roxani from Health to You. Then we got Linda Green from Pinpoint. Then we got Redwa from Health Watch. Then Sarah from PCVS. Then we got our wonderful lady Tanya Smith. Yeah, I know we got a lot to talk about today. But after those people, the floor will be open to everyone. Whoever wants to ask question, you are more than welcome. And also, in case it's 12 o'clock and any one of you want to leave, you are more than okay to do so. Yeah, but I will try my best to make sure that it's finished within 1 hour. Yeah. Can I kindly pass the floor to Catherine Goose, please?
Good morning, everyone, and thank you for inviting me.
Yeah.
So, as Usman said, my name is Catherine Goose. I work for Cambridge and Peterborough Clinical Commissioning Group. I've come just to give you a bit of an overview about a new service that is currently being commissioned, and then sort of any sort of general sort of questions and queries you've got. So, just to let you know that Cambridgeshire Clinical Commissioning Group, Peterborough City Council and Cambridgeshire County Council have come together, and we are remodelling how we're delivering early intervention mental health services for children and young people. Rather than it being a standalone service, we're looking at a partnership model, which will be between Cambridgeshire Peterborough Foundation Trust, so that's CPFT, who's our main mental health trust, Cambridgeshire Community Services, who's one of our community providers, Centre 33 and Ormiston Families, who are voluntary sector organisations, to deliver a partnership model of delivering clinical services. So this service will start the 1st of July across Cambridgeshire and Peterborough and will be for 0 to 25-year-olds. the exact model I can't give you lots of detail about today because that's still being worked through, but certainly would welcome to come. I'd be happy to come back when we've got further detail. It might be useful for the service leads to come and have a conversation when they've got that detail exactly around. So I can't give you details today around how you would access the service, etc., because we're still working through some of that detail at the moment. But just to say that in principle, there will be a single point of entry, because what we're very aware of, and one of the sort of reasons we came to this point in terms of remodelling, was that there's lots of silos of service delivery for children and people's mental health, and how do we stop people bouncing around the system? So this new partnership will have a central point where, rather than going, oh, you're not for us, they will actually facilitate, review what those referrals are, and assign children and families to the most relevant and most suitable service for their needs. A big part of the new model as well is around choice. So one of the things that we have identified during lockdown is that some people really have missed the face-to-face. So face-to-face is really important, but also a lot of people have really taken on the idea and the concept of using digital technology to help support them in their emotional well-being. So again, part of the new model, the new partnership, is around having choice around how you access services. So there will be a range of virtual and face-to-face provision available going forward. We're very much focusing in this model around what outcomes we want to achieve, rather than previously it's all been very much about the numbers through, but we're very much keen to look at what we can do to improve the outcomes for children, young people and families. And we do have we have a number of I statements, so that sort of structure how the services are going to be delivered and monitored, and one of them specifically is around families. So that I statement is, I will know that my family has been supported to help me manage my well-being and mental health needs. Because one of the feedback we got, we went out and spoke to many children and young people, was actually not just their own well-being, but that of their family and their carer networks, and how they can feel supported to know where to go and know how to help the young people. So that's a really important part of the model going forward as well. So say at the moment, this new service will be starting on the 1st of July, and the details around how you access it, etc., is going forward. One of the things that CPFT, who's leading on it with the partners I mentioned, is around having a brand, so understanding and what is it that we're looking for. So they're going to be doing lots of co-production work with children, young people, and families, to think about how we call it, how do we structure it, how do we get the information out there. So that's a key part of the approach as well going forward. In the meantime, between now and then, so the current services still continue. So Chums is still continuing to provide a range of early intervention support for children and young people. Who is our online digital provision, they are still there. One of the other things that's happening as well in mental health is around mental health support teams in schools. So just want to give you an overview around that. So the first bit is, that's the partnership model, and I'll take some questions around that in a moment. But if I can just tell you about mental health support teams, is that okay? So the mental health support teams in school, this is a national initiative, and this is around having practitioners in schools. So there'll be specific schools around, and they can deliver low-level intervention. They help schools understand how they make a healthy school environment, and how they can support families and support staff to make sure there's a real sort of collective view around how you look after the well-being of the pupils and those around them. We've got two teams, well, we had two teams, one in Cambridgeshire, one in Huntingdonshire, and we've just got another two teams, and one's in Peterborough. So they have just started at the end of January. So they're a training at the moment. So over the next year, they'll be training to be upskilled. So they work with specific schools. So each team works with about 20 schools. But one of the things that we're really excited about is that we have had the opportunity to apply to have more schools. And one of the things that we're very aware of is the demand and the need for support in Peterborough. So we've got one team, so they just started, and for going forward, we've asked, can we have another team in Peterborough as well to cover the broad, because say each team covers 20 schools, which only covers a small proportion of the need in each area. So that's one of the things we're looking at. So has anyone got any questions?
All right. Thank you very much, Catherine. If anyone have any question, please, you can just ask your question now, please.
Catherine, just to jump on and say about the schools initiative that's setting up, are you linked in with Everyone Helps Healthy Schools initiative?
Yeah, so there are lots of things going on around schools. So one of the things we are trying to link up, so there's the healthy schools. There's been quite a lot of work going on. So the Department of Education released some money for wellbeing return to school. So there's been lots of input into schools. And I think one of the things we're really mindful of is that schools have got a lot going on. And how do we support them and not overwhelm them? So yeah, we are linking it all together. And that's the mental health support teams schools. They sit within Cambridgeshire Community Services and they link really closely across. So yeah, thank you.
Well, anyone has a question?
I just wanted to ask a quick question. Is there any way we could have a list of what schools have that intervention?
Yes, certainly. I can get the definitive list. I know we did have an issue with getting some schools engaged, but I can get that definitive list for you. Yeah, certainly.
Yeah, that would be helpful.
Yeah,
thanks.
So it is for primary schools and secondary schools, and there is one special school as well, and they're also working with Peterborough. And I always get it wrong whether it's regional college or city college, so I will get the definitive list and let you know. But it is one of them, but I can never remember. It's one of those mental blocks. I always get it slightly confused. So
yeah, no, it's just to be honest, just because my little boy's going up in September. I just wondered if there was any intervention in that school. To be fair, that's the only. Yeah. Just to know if they were one of the schools, participating.
Yeah, and I think that's really important. One of the things we've said is that when we do some, it's a balance between the communications, but one of the key things is that parents know, so they can actually say to the schools, actually, I know that this school has one of the mental health support teams, therefore what can they do? So I think that is really important part of the whole communications around that. As parents, whether your school has got one or not, so whether that's an additional support that you've got. And the idea is that over time that every school will have one, but obviously that just takes time. But yeah, no, certainly I can get the list.
Right, thank you.
Thank you very much. Any more questions, please?
Is it voluntary? Is it voluntary that they be part of this scheme, or is it going to be mandatory in the end?
So at the moment, it is voluntary. There are some components. So originally, when the teams first came out, the schools had to have space to be what they call placement schools. So they had to have space to have the trainees. Since we've all gone digital, that's slightly changed. And originally, schools didn't include schools that were deemed by Ofsted as needing improvement. But again, that's changed again. So they keep changing it. So we have encouraged, but I have to say, in fairness, most schools have been quite willing to be engaged. I think the challenge we've faced with these last two lots of teams is we're asking them when they're all during lockdown, and so actually getting to the right person in the school was the bit of the challenge. But ideally, the idea is that all schools will be involved.
That's great, thank you.
Yeah, thank you very much. Any more questions, please? Any more? No? Oh, Catherine, thank you very, very much for your wonderful speech. I hope we will lead you before the session finish anyway. So now we were meant to have Francis Thompson, but I think so she's not available at the moment, so I will.
Yeah, no, I'm here. Sorry. Hello.
Sorry, hello. You all right?
That's okay. I realised my name isn't right. So
yeah, because I couldn't find it anyway. That was the problem anyway. Anyway, the floor is yours now, Francis. If you wanna have a go, and yeah.
Thank you, Usman, and thank you for Judita for inviting me today. So I just wanted to come and publicise a piece of research that Centre 33 Young Carers Project are conducting at the moment. So we support young carers. So a young carer is anyone 18 or under who supports someone in their family with an illness or a disability. So we support all those young people. We support them with their emotional well-being, with practical aspects of caring, essentially making sure that those young people can be whoever they want to be and access the same opportunities as their peers. And we've received some additional funding to look at a really important issue in terms of young carers support, which I think both the Black Lives Matter movement and the COVID pandemic have brought to light, which is that young carers in Black, Asian and ethnic minority families are actually more likely to be caring for a family member, but less likely to be receiving young carers support. So there's a mix of reasons for that. There are some reasons we think that minority ethnicity families have more young carers. So it could be that different cultures have different sets of issues they face. There are higher rates of mental health problems in some communities. There are genetic factors that cause different ethnicities to have different degrees of health conditions. Families can be isolated from support networks. They can live with multiple generations in a household. And so COVID has obviously shown that illness can disproportionately affect these groups and some people's vulnerability as well to scams about the virus or the vaccine. I think we've really clearly seen how that's impacted different ethnic groups. So why are they not getting support? Again, this is what we're trying to understand in our local area. So nationally, there's been some research indicating that caring is seen quite differently in different cultures. There's actually not a word that translates into English into the word caring in many languages, especially in South Asia. Obviously, there can be language barriers. There can be distrust of services or misunderstanding of services. Some professionals make assumptions, of course, about different families and their ability to cope, their sort of cultural ideas of caring. And we're really trying to look at this in detail and hear young people's and parents' voices from different diverse ethnic groups to understand their experiences and what support they feel would be valuable. So we're hoping to run some focus groups with young people and some interviews, but today I've just got a really short questionnaire which I will put in the chat, and I invite you all to respond to that and to share with your networks. Let me know if you want me to translate it into different languages. I can do that, so I'll just pop that in the chat with my email address, and yeah, please share. I've heard so far that the power of word of mouth is probably going to be the most important in this project in reaching some of these communities. So yeah, thank you very much, and I'm happy to take any questions as well.
Wonderful. Yeah, if anybody has a question, please, you can have the floor now, please.
Oh, hi. My daughter is a young carer. I'm just wondering how, obviously you've taken over the contracts, haven't you, from, I think it was, who was it? Carers
Caring
Trust?
Together, yeah.
Carers Trust. And I'm not too sure how to access your services or things like that to get her support.
Yeah, so I'll put our website in the chat. It's there's a tab at the top of our website that says caring, and there's an online referral form that you or your daughter or whoever can complete and do a self-referral. It goes straight through to our email, and we will get in contact when we've received that.
Right, okay. And another question, are you responsible for sibling carers or not?
Yes, yeah, we are. Yeah, sibling carers, parent carers. We can also signpost to other support services for sibling carers. I know there are some other services as well out there, but yeah, and any young carer, sibling, parent, grandparent, whoever.
Okay, thank you for that.
Thank you.
Wonderful, thank you. Anyone has a question?
Hi, Esme. Yeah, I have. Francis, did you mention the Young Carers Board?
I didn't mention the Young Carers Board. I'm not the best worker to speak on that, to be honest. I've never been to the Young Carers Board. Is that for young carers or for all carers?
Young Carers. It says, I follow you on Twitter, or your organisation on Twitter, and they did a piece about each one but he didn't actually say where they came from. He gave their spiel about what their background was when it came to caring. But I asked a question on the Twitter feed, what was the split? Was it 50-50? Because obviously it covers Cambridgeshire as well as Peterborough. So I was just, and I asked that question, they've not had no response back.
Okay, I can chase that for you and see if someone can get in contact with you, Jason, if you want to know some more. I don't know off the top of my head how many young carers on the participation board are from Peterborough, but obviously as we're new to Peterborough, it might be less. We have fewer referrals from Peterborough at the moment, but we're getting lots in.
Of course. Yeah, I was just interested to know what the ratio would be.
Yeah, I can definitely find out for you and see if someone can let you know.
Yeah, cheers, Francis.
Okay, thank you.
Thank you, Jason. Thank you, Francis. Is any more question, please?
Yeah, please. Hi.
Good. Brilliant. Thank you.
So you say the young carers is up to like age 18. Is there any sort of support out there for like 19-year-olds that are actually carers?
Yes, so there is an adult carers support from Caring Together. So they work with young adult carers and adult carers from age 18 up. But something that we do is any young carer who is age 18 or perhaps a bit younger, we can support them to transition into that adult service. So it would be Caring Together for, say, a 19-year-old, but they have sort of quite a specific way that they work with young adults to support them, because obviously they might not be as independent as some older carers.
Okay. Is there any link to that at all that we can get?
Yeah, I'll put something in the chat for you. I'll just get something up for that.
That's brilliant. Thank you.
I think if you check the chat, there are some link there. Any more questions, please? No one. All right, let's move to anyway. Thank you very much, Francis.
Thank you.
Thank you very much. I appreciate it so much. Yeah. So now we are going to pass to Sarah McLear. Sarah, sorry if I pronounce your name wrongly.
All right, it's an unusual one. Don't worry. It's Sarah McLeod.
I do apologize for that. It's from Macmillan. Yeah, Sarah, the floor is yours now. Yeah, thank you.
Thank you. So thank you for the invitation to join your meeting today. I work for Macmillan Cancer Support, and many of you will probably know about us, but those that may not, Macmillan is a support organisation that works to support anybody affected by cancer and their friends and family. So we help people around understanding, their diagnosis, their treatment, what's going to happen, side effects, how to support those. But we also work around supporting families, how to talk to children when someone has cancer, support for carers, making sure that people understand how to look after themselves while caring for a partner or family member with cancer. We have advice on work. So we know many people with cancer are working age and need support around what they can expect from their employer. And we also support employers and organisations to know what they can do to help people with cancer that work for them and what kind of adjustments can be made. And we do have financial grants as well. We do give out a lot of individual grants each year for people who need that. Cancer, we know, comes with many costs, and often people are really stretched and just need something small to be able to get things like washer dryer or a new fridge freezer or something that is just beyond kind of what they can manage while they're also juggling all the costs of cancer. We also have welfare benefits advisors. All of these can be accessed through our phone number, is probably the easiest thing at the moment. So we have a website, there's online chat, there's lots of web pages, there's an online community, but the phone number is a free number, and that's the most accessible if people aren't sure what they need or what help is out there. So it's a free call number, open every day of the year from 8 in the morning till 8 at night. And on that number, you can talk to a nurse, information support worker, a benefits advisor, somebody who specialises in work and cancer issues, and you'll just get referred on to kind of whoever's the most appropriate person. But it's also absolutely fine to phone and just have a chat. It's fine for someone to call and say that someone they know has just been diagnosed and they've got questions, but they don't want to ask that person, but they just want to understand a bit more. What does it mean when they've said this or when they've said that? Or for people with cancer themselves who perhaps didn't think of something at the time and have now come away from the hospital and are kind of just wanting to check out a bit more about what they've been told and how it might affect them. So we really look to support anybody with cancer around however it's affecting their life, work, family, all of their well-being. We also have an interpreter service on our phone support. So if somebody would prefer to speak in another language to English, if they phone our free call number and then there'll be a short recorded message that tells you that the calls might be recorded to check that they're being done well. And after that, if you just say the language you need, Portuguese, Romanian, Lithuanian, and then they'll get the interpreter onto the line, so there can be a three-way conversation between the information and support advice and the interpreter and the person calling in. So that's always available as well. We do have some of our literature, all our booklets and things are online in PDFs or can be posted out. We've got easy read guides on lots of things as well for people who either have learning disabilities or for people as well who perhaps don't speak English as their first language and would find a guide with more pictures and things in much easier to understand. And those cover a lot of subjects. We also have support in British Sign Language. We have audio as well, and we have some support available in Braille and things like that. I'll put my details and my email in the chat. So if anyone's got any specific things they'd like information on, please do feel free to just email me and I can send that over if it's anything's urgent, because I know it can be quite a lot to search a big website, and that when people are really busy, they don't often, find time to make the calls so easily. I think it's just making sure people know that we've got lots of support on pretty much any topic that could come up when you're affected by cancer, and we just want people to know we're there and to give us a shout and see how we can help as and when. We also, particularly because this is looking at emotional support and mental health today in your meeting, we've just started a new counselling arrangement with Bupa. So people who would benefit from some counselling who are diagnosed with cancer, if they phone our support line and talk it through, then again, if it's a suitable referral, they can get referred for free counselling sessions with Bupa at the moment. And we're running that with them. Just aware really of the huge impact of COVID and cancer over the last year or so for everybody. So I'll stop there because I'm aware it's a quick intro today, but I'm really happy to, get in touch or, do just contact me by email anytime, and just let me know what else you need really, what will be useful for you. And if we don't have it, I'll make sure it gets flagged in that this will be useful and we should be working on it and just see what we can do. And just really also to say we're aware that we can't fix everything around the impact of cancer for people, but if it's issues that are bigger and more national, we do flag those. We talk to MPs, we do campaigns, we constantly work to make sure that things that are long term for people, that those are being raised with people who make decisions right at the top of government. And we work really closely with the other big health charities as well. So heart, diabetes, stroke, we work together at the top to make sure that whatever issues are coming up for people affected by long term conditions, which cancer often is for people now, that those are being flagged up and that different charities might take the lead on different things, but that we're all working together just to really give people the best quality of life and whatever is important to them. But I'll stop. So any questions, and I'll put some links and I'll put one of the booklets in the chat so you can see the kind of thing that we're talking about, and let me know.
Wonderful job, Sarah. We'll be very happy if you could share that one on the chat area, please. Thank you. If anyone has a question for Sarah, can you just have the floor now, please? It seems like everybody's okay. Yeah. Thanks once again, Sarah, for the wonderful information that given to us. Yeah, I think we got your contact details here. Definitely, if anybody needs to contact you, definitely we'll use that one to get in touch with you. Thank you very, very much once again. So now I will pass the floor to Roxani from Health to You. Roxani, the floor is yours now.
Thank you very much. Thank you for Judita and Usman for having me today. I know today's meeting topic is focusing around mental and emotional well-being. Health for You are a free integrated lifestyle service, so we're commissioned by Cambridge City Council and Peterborough City Council to deliver a wide range of physical well-being services. So we all know, especially after the past year, that what impacts our mental health and well-being can also impact our physical well-being as well. Yeah. So we're completely free to access. We've got a wide range of services. So we've got an adult weight management service, which is for anyone aged 16 or over. It's a 12-week rolling program. It's led by nutritionists and physical activity specialists, and they cover a different topic each week. And exercises are tailored and adapted to suit the individual's capacity. We also partner for the weight management service. We partner with Slimming World and Weight Watchers to offer 12 weeks of free support through them if you're eligible and haven't been a paying member in the previous 3 months. We offer a general place-based health trainer service. Anyone who is looking for motivational support to achieve their goals around their physical well-being, so whether that's increasing activity, eating healthier, reducing stress or sleeping better. Mm-hmm. We also launched on the 16th of February a new service, so we've got a Eastern European health trainer service now, so we can support people in their national languages. So we've got Czech, Slovak, Polish, Romanian, and an understanding of Portuguese and Spanish as well within the team. So again, that's all around the motivational support and the behaviour change advice to make positive lifestyle changes. To reduce barriers to the service, the team have got their own dedicated email address and their own dedicated text numbers as well. We also have a mental health trainer service. So just to say that this is not a counselling service, it's still very much focused on that physical behaviour change. But the practitioners in this service have an increased awareness of mental health conditions and the impact that can have on people's physical health as well. For this service, people get longer with their health trainer, so they get 8 sessions rather than the standard 6, and for each session they get 45 minutes rather than the standard 30. Mm-hmm. We also do a stop smoking service, so anyone who is age 12 or above can have support to stop smoking, whether they want to use an e-cigarette or whether they want to use nicotine replacement therapy. Obviously, these cigarettes aren't available on prescription at the moment, but all of the nicotine replacement therapy will be at your standard, your standard, prescription, that's it, your standard prescription cost. And obviously the advice is tailored to suit the individual. Also, we've got alcohol health trainer service. So anyone who is drinking at an increased risk to health, they can have support with our alcohol health trainers to help support them to lower their risk and their drinking levels. If they are drinking to a addiction level, then obviously we work very closely with CGL, who are the drug and alcohol specialists across the county. This is a lot of information, it's a lot of different services. We're very aware that we need to sort of rely on word of mouth, which is why I was very pleased to be invited today. We do have one website, we have the one text number and the one phone number for any referrals, and I'll pop all of the details in the chat if anyone wants to know any more.
Wonderful, Roxanne. I think Agnieszka is asking a question. She said how to enroll for support on weight management program, please.
So to enroll for support on the weight management, if you go to our website, there's a referral form and you can refer yourself directly. If you want to pick up the phone and call us, it's a free phone number. They're open 7 a.m. till 7 p.m. Monday to Friday and 7 a.m. till 12 on a Saturday. Or you can just simply text Healthy You to 60777. So you can self-refer or professionals can refer as well.
Roxanne, is there any possibility that you can share some of your information here, like the contact details, so that people will be able to get it here?
Yeah, I will do. I will pop it in the chat and I'll pop my direct email as well in the chat as well.
Oh, wonderful job. That's very good. Thank you. Very kind of you. Thank you very, very much for having you today. Yeah. If there is any question, if anybody has a question, so the floor is yours, please.
Yeah, please. Hi.
Karen, thank you very much. Yeah.
So just what is when you say like the self-referrals and everything like that, is there a waiting list for these or do they just go through?
No, there's no waiting list at the moment for any of our lifestyle services. From point of referral, so from the point you click send on that referral form or that text, we aim to access it and call you back within 72 working hours. Obviously, weekends, bank holidays does play a part. But yeah, we'll try to call you back twice. We'll try another contact methods, whether that's a text or an email, if that detail is provided, and then we send you a letter. So we do try numerous times to get back in contact with people, but as it stands, there is no waiting list for any service.
Okay, thank you.
That's all right.
Any more questions, please? If no, then thank you very, very much, Roxani. Yeah, can I ask Linda Green, please, to have the floor now from Pinpoints? Linda, if you are ready, if you are
I feel
ready,
so lucky.
Yeah.
Thank you. I feel really lucky to be here because I'm learning every single time I come to these sessions, and it's just great that you pull us all together to share this information. But what's so clear is that there's loads of us doing so much and we just don't know, and we need to tell each other as much as possible about this. So thank you for sharing your details. Pinpoint basically is the exact same as Family Voice. So we are a parent carer forum in Cambridgeshire, and that's the only, it's the geography that it makes us different. However, we kind of have a sisterhood with Family Voice in particular, because boundaries, as we all know, you know, for health, for so many other areas, that it can cross over and it can mingle. I'm so delighted that we're working together, but I'm really passionate about the work that Pinpoint does, because every single one of us is a parent carer ourselves. We have all experienced the isolation that comes with having a child who is considered different. And the minute that you feel that your child is different, or that you're sent on a parenting course, for example, you immediately feel as a parent that it's your fault, that you're not, that you have a guilt feeling about the fact that, you know, you're not getting it right and you're the one that needs fixing, when in fact, what you probably need is simply support and information. And so we are around to make sure that you get that. And currently, especially since COVID, we've been offering at least 2 sessions each week. So on a Monday, we have information sessions on various topics around autism. We're going to be doing them about continence. We're going to be doing them about challenging behaviour, because one of the things that we've noticed a huge increase in is the behaviour of our children who have additional needs, because COVID has meant the respite facilities and the short breaks that families used to get isn't happening, and that obviously parents homeschooling a child with SEND is just it's heartbreaking, to be honest. If you struggle with a child that hasn't got SEND issues, it is really heartbreaking. But one of the things that is incredibly hard for some of our parents is accepting that their child has a difference. The truth is we all have a difference. Science says that. We've all got different DNA, so everybody's different. Yeah. So it would be great if we could just embrace that, you know, but also from education and from so many other circumstances, we do need to be able to fit in and to form relationships. On a personal note, my son, I had 4 children, 3 girls and then a boy, and my son acquired a disability at the age of 5 when he had meningitis, and he lost his leg below his right knee. And when I was told, oh, you know, he has a disability, I said, no, he hasn't. And I didn't accept that my son had a disability, and using that word for my son just was such a difficult journey for me to accept, that actually that's okay. It just means we have to approach things slightly differently. And that's exactly what we've done. But to do that in isolation is going to have a huge impact on your mental health. So one of the things that we want to aim to always do is to give parents the opportunity to meet others who get it, to meet others who understand. And just like today, where we're all together and we're all wanting to just support all of these amazing families, we want to make sure that families know they are not on their own. That's number one. And number two, we want to give them the information that they need. So actually, they need to tell us what's the problem at the moment. So that's why we're delivering sessions around anxiety, around challenging behaviour currently, but we also always work on autism, ADHD and other disabilities or additional needs that children may have. We ran one in Peterborough last week with Judito, which was absolutely wonderful to have. And it was just an introduction to autism. So the people understood that actually the body is wired differently, and that's hence the behaviours. But what I'd really love to do is to just promote the fact that Pinpoint and Family Voice are working together. Any issues that you see coming up on a common basis, let us know, because every month we're going to be doing a subject topic specifically to Peterborough, and mental health of our parents and carers is absolutely vital, because the parent is the constant. If they fall down, then the children are going to be impacted hugely. So we have got to look after our parents and carers. I will just pop our website onto the chat there. It is the easiest thing. We don't need a diagnosis for you to come along to our online sessions. They're all free to parents and carers, and you simply go onto our website and you just press the link, and you'll be able to come along to our sessions with some amazing speakers. Thank you so much for just letting me explain that, and Judita and I look forward to asking you to watch this space for things specific for Peterborough.
Oh, wonderful speech, Linda. Thank you very, very, very much. You know, I'm glad that you are here. Definitely.
So am I.
We're very, very happy. You know. So if anybody has a question, please, Linda is ready for that. Anyone, please?
I just want to stress, nobody needs a diagnosis. So if you do encounter families that are struggling, then they can always be sent our way, and we'll never turn anybody away.
Oh, that's lovely. That's absolutely fantastic. You are very kind of that. Thank you very much for that. You know? Like I said, thank you very, very much. I don't think there is any question. If anybody has a question at the end of the session, you can also ask the question, please. Thank you, Linda. Thank you, Linda. Thank you very, very, very much. You know, I appreciate it so much. Thank you. All right. Now, can I pass the floor to Repwa Hussein, please, from Health Watch? Repwa, if you have anything, please kindly come forward, please. Thank you.
Shall I share my screen with the presentation? Actually, first I will say a little bit about Health Watch, who we are and what we do. And with regarding the session, you did ask me if there's something about mental health. What we've done is
you want to share it on the screen, yeah?
If it's possible, yes, I would like to.
Definitely. Let me ask, I don't know, Ramu, can you allow Rebwa, please, to share the information, please?
Yeah, should be able to share it.
Yeah, John, all right, thank you. Thank you, John.
For disabled participant screen sharing, still I'm not, haven't got the permission to do this. John,
he's still waiting. Linda, can you also share your contacts on the chat area as well, please, Linda? Yeah, sorry, Rebwa, to interrupt.
That's all right, yeah. Should be okay now, I think.
All right.
Can you see it?
Yeah.
Great, yeah. First, I would just say a little about Health Watch. Health Watch Cambridgeshire and Peterborough is the local statutory Health Watch provider. We are part of Health Watch England. We are the independent champion for people who use local health and social care services across Cambridgeshire and Peterborough. Our job is to make sure that those who run health and care services understand and act on what really matters to people. We listen to people across Cambridgeshire and Peterborough to find out what they like about services and what could be improved. So what people tell us, we share with the power to make change happen. What we mean with that, we share with the service providers as well as with the clinical commissioning group who are plan and pay for the care. And also we share with the Health Switch England to find out whether the concern are local or national. We encourage service to involve people in their decision that affect them. We also help people find the information they need about the service in their area. That's the kind of the service we provide and we're doing. We also have some other service with the information team. We have a called Inter and View team, which is now the service has been suspended due to the COVID-19, which we used to go to places like GP practice, dentist, care home and nursing home and talk to people in there with their staff, nurses, carers and residents and observe what happened in this place and write a report, make recommendation for improvement and then share our report with Cambridgeshire County Council, Peterborough City Council, Adult Social Care and Care Quality Commission if they want to do further investigation. This is just briefly about who we are and what we do. So with regarding the mental health, Yudita asked me if we have something to share with. Actually, I just said I will talk about the COVID survey. We did it last year and which is around the change to the services in the health and care services for local people. So what happened is in May 2020, Health Switch Cambridgeshire and Peterborough launched a 3-month survey. Our survey ran from 28 May to 31st of August, and over 1,100 people respond to us across Cambridgeshire and Peterborough. We listen to health and care experiences of local people during the first wave of the coronavirus pandemic, particularly for those who were most likely to be affected by changes to services. And as part of the project, so we published 3 survey briefing, one in July, one in August, and one was in September, highlighting key findings to local services. So at the end of this, we published a full report, which we called Your Care During COVID. That was on the 22nd of October 2020. So we said who we spoke to, who we heard from. We said, as I mentioned about the carers, actually nearly 1 in 3 people who participate and they say talk about care, they were the unpaid carers. That was something we found it, and 6 in 10 needed to use health service during the survey period, like including urgent and emergency care. 139 people used the service, and hospital 123. The majority number came from they used the service at the GP, and then with the other service providers like the pharmacy, dentist, the mental health, and others. So over 4 in 10, which is 40%, had a long-term health condition or disability that people we spoke to. 73 people with the additional communication need. What we mean with that, that's people actually asking for either the British Sign Language, Braille, audio, large print, easy read, and another language that the people needed the additional communication need. And nearly 2 in 3, they or someone they care for was at risk of serious illness from COVID. The key themes of that, we asked people if they have any message for NHS staff, carers, or key workers. So we received 688 messages from them, the majority which were thanking NHS staff and key workers. With the communication, many told us how problem with communication, both locally and nationally, caused them problems. They told us how the pause in treatment affected their long-term health condition. The mental health, nearly 75% told us the pandemic has had a high or significant impact on their mental health and well-being. So changes about the COVID-19 has made the time harder for nearly everyone. We know that, but for those who provide care for family member or friend, this time has been extremely challenging, particularly when a normal care arrangement broke down. Concerned with those with the digital access, we know actually that many of the service went online, including booking an appointment, talking to seeing your GP, and that has been difficult for aging people and people with the learning disabilities. I'm going to slightly showing some data about mental health, as you did ask me to do this if something available, and therefore I brought some data. With the question we asked about how much the impact had the coronavirus pandemic had on your mental health and well-being, and nearly, I think that is almost everybody answered this question, and the impact was 1 is not much, 5 is significant. And if you see on the table, actually 141 people rated that they've had a significant impact on their mental health, and 223 rated 4, and 300 rated C, which is really high compared to see only 256 people with not much, but almost everybody. The pandemic has have had impact on their mental health and well-being. So have you or anyone care for being able access to the sport? This is the question we are asking, and actually the outcome is, as you can see, 605 people haven't needed sport, which was good. But from those actually needed the sport, and we asked it where they get it, which you see family friended at the top one, where the people actually receive its sport, followed by the mental health care providers, 63, and the community voluntary group, also from online, like telephone helpline, online app, and others. The things actually 129 people said that they didn't get sport. Let's see why they didn't get that. And with that, actually, you see 21 people didn't seek help, and some of the others, 17 people found it difficult, or there was no service available. And some of them, also 15 people, say that from previous experience, the impression of local service, maybe they didn't have a good experiences. 14 say other service closed, and some others, also 2 people, for example, scared to go and seek for support. With the word that people actually found about the information about mental health is, as you can see, social media was the top, and TV, radio followed by, and also people received printed literature. And 102 people also receive it from GP or health professional. 57 people got from friend, and as I said before, is 605 people also say they didn't need it. So with the key findings, we know actually many older people, or with those with disability or long-term health condition actually care, or long-term health condition cares, and those not online are hit the hardest because of the actually access to online appointment, and actually talking to your GP through a phone, or maybe with through the app on the camera is not the easiest way, or actually maybe have no technology to access. And nearly 75% say there was high or significant impact on their mental health well-being. So the pandemic has increased demand and pressure on mental health services now, and is likely to increase the demand and pressure more for some time to come. 30% avoided getting help for their health, but 75% those who use the services actually rated fair, good, or excellent. That means actually that was a good outcome. 75% were very satisfied with the services provided. And about the shutdown to the dental services, actually we know we had a problem even before the COVID about the NHS dentist, and especially in Peterborough and Fenland. And we know the COVID made the situation even worse for that. Lessons for all, that's including actually we need to have a better and clear timely communication. We said, people say that building on technology use, but find solution for those who cannot arrange remote appointment. Address concern over inequality and digital exclusion, people who are not actually, we have to think about people who are digitally excluded. Understand the isolation for new family and the disruption impact on those with additional need. Potential to co-produce self-care information, incorporate new way of working cooperatively to strengthen community network. So our local health commissioner, the people who plan and pay for most health and care, social care service in Cambridgeshire and Peterborough, have welcomed your feedback. Here are some of the response on our 3 COVID briefing published during the survey last summer. And one is from Agent Chapman, Service Director, Communities and Partnership for Peterborough City Council and Cambridgeshire County Council, and also Carol Anderson, Chef Nurse, Cambridgeshire and Peterborough Clinical Commissioning Group. So actually the reports are available, the full report and also 3 briefings on our website, on our Cambridgeshire website and Peterborough website. The reason actually we put these 2 websites because HealthSwitch, Cambridgeshire and Peterborough merged in April 2017. This is just information, but we still have 2 websites. Therefore, actually, I have put the 2 links on our the slideshow. Please, to find out more about the survey and get more data about, you can visit our website, and also I will put HealthSwitch contact details on a chat box if anybody need to talk to us to share their experiences or have a question, need to find out more information about local health and care services. They can contact our information team. We have a free and confidential information we provide. Thank you very much.
Thank you very much, Rabo, for sharing this wonderful, this useful information. Anyway, I can see there's a correction. I know we almost ran out of time at the moment. So, but like I said, I mentioned earlier, if anybody wants to leave, please, you are okay to do so. But definitely, we got a lot to talk about, and that is very, very important. If anyone can stay as well, that will be absolutely fantastic. So yeah, there's a question from Linda, I think so. She said, was that 605 who didn't need it, or 605 who didn't access it? So, and there's a question also, was it the younger generation who accessed mental health support?
With the question consisting of 5 people, as we said, actually that is 1,100 something people actually responded to our survey, but 605 people didn't use the services.
Yeah.
But with the question, actually, with the impact, almost everybody answered for that question. That nearly more than 1,100 people answered for that they had the impact of the COVID-19 had the impact on their mental health and well-being. What's the other question, Usman?
Yeah, the other question is, was it the younger generation who accessed mental health support?
With that, actually, we don't know actually about but I have got information about the people we spoke to. Let me get another one. Some more data is.
I'm just aware that my mother's generation, wouldn't ask for help specifically around mental health, or rather my mum wouldn't ask for help and call it for her mental health, but she'd happily go to the doctor about her leg that was sore. They're different conversations.
Right, yeah. Actually, what I said is this: that's the people who rated. Sorry, can you see the slide on my screen?
Yeah.
That is actually the people who had the experience with the healthcare. This is the answers came back about the excellent, good, and fair, and then with the we haven't got actually the number, but what is the didn't see is. And also, it's just where the people actually about the highlighted with the answer. This is the geographical area we received the response that Peterborough 264, Huntingdon, but with the age. Let me see if I have got the data with the age. This is actually the people how the age of the people they participated in the survey, but that's not actually with the only mental health, because that was basically we asked about all the health and social care services. That is not just the mental health. Just want to be clear, actually. But the reason I presented data about the mental health, because the session today is about the mental health. You can find a full report on our website. And this is the age group people they participated. And also with the gender. This is the data of their genders. Actually, the majority were female, and 240 male, sorry. And 6 others, and 46 people prefer not to say. Ethnicities, actually, I would say less than 10% it was from minority ethnic community. Otherwise, it's mostly said British white, and also 1.6 Irish as well.
That's really helpful. Thank you so much.
You're very welcome. Thank you.
Rebo,
yes.
Thank you very much. I think Agnieszka, she's mentioning something. She's saying like, even dentists hope not responding. I'm calling every day at 8 a.m. but never get in touch. It is very, very bad. Yeah, I think I would need to pull out my teeth. Yeah, myself. I don't know how you will be solving that problem with NHS dentists, and it is not about COVID. I know there is not enough NHS dentists in Peterborough. What's your take on that?
Actually, as I mentioned, we were aware of the access to NHS dentist is very difficult, even before COVID in Peterborough and in Finland. As followed by our inter-review team visit the Dental Access Centre in Peterborough and some other dentists, we produced a report and we published that report about the dental problem. Clinical Commission Group actually increased some budget for the Dental Access Centre in Peterborough and Finland. That was in 2019 and continued 2020. I'm not sure whether the service is still available for them. But during the COVID-19, actually, the Dental Access Centre were taking people. Even if you are not registered with any dentist, you can still use the Dental Access Centre for some urgent treatment. Otherwise, you need, if you call to our information team, ask them about, they have the database, they will tell you if there's any dentist available in Peterborough or surrounding area. We know at the moment, as far as I'm aware, actually, there's no dentist in Peterborough taking anybody. And many of them, they have a very long waiting list as well. But sometimes our information team, they direct people to outskirts of Peterborough. I remember actually recently they sent in people to Ondel, Spalding, Huntingdon, and some other areas as well.
Mm. All right. Wonderful, wonderful. Thank you very, very much, Rabwa. I
Thank
know
you.
we are out of time.
I would advise to contact our information team. They mostly actually will tell you if there's any dentist in our area taking people.
Thank you very much for that.
Thank you.
Yeah, yeah. Can I have Sarah, please, from PCV? Yes. Sorry, guys. I know we are, we are out of time at the moment, but I think we got important topics to discuss anyway. So, yeah, I do apologize for that anyway. Thank you very much.
Problem. So very early on during the pandemic and the health crisis that we saw ourselves facing, PCVS pulled together all the voluntary and community sector organisations within a network so we could disseminate information out to those organisations. We have a specific mental health forum and disability forum that we run. We have 12 organisations that regularly attend both of those on a fortnightly for the disability forum and a monthly basis for the mental health forum. We also gained some funding and now have a wellbeing worker working for PCVS, and anybody can refer into that wellbeing worker themselves or from an organisation. I will say it's really lovely to see everybody here and networking, and also I come from a place where yes, I work in the voluntary sector, but I also am myself a parent carer. I have a young child with ADHD and we're currently going through an autism diagnosis at the moment as well, and I was a young carer myself because my older sister has Down syndrome, so I have quite a lot of experience. I am happy to refer people if they want to talk to me directly into the wellbeing worker, or you can refer yourselves directly in there. All the details are on our website, and thank you for inviting me to talk today.
Oh, wonderful, Sarah. Thank you very, very much. I know, we ran out of time, but definitely, good to have you on board today. Yeah, thank you very, very much. If anybody has a question, yeah, you can come forward anyway. It looks like Rebo, what do you want to say? Or Faustina?
No, thank you.
Yeah, Faustina, anybody has a question for Sarah, please? From PG.
Sarah, put the link on of the website, please.
Link, yeah. Sarah, can you share your link, please? On the
Thank you.
I'll put it in there for you.
Yeah, yeah. All right, now Tanya, can you have the floor, please? Yeah, if you have something to say, please. Thank you.
Hiya. Yeah, sorry, I'll put my video on, then you can all see me.
Well,
yeah, just really about the food support around Peterborough and things like that for vulnerable families at the minute.
Yeah,
I know Little Miracles are doing food support as and when to vulnerable families, children with SEND needs, so anyone with special educational needs and disabilities, they can support because they've got Chilterns donating food, and then if you just contact them, they can arrange you collecting, or they, if you can't collect, then they can deliver. Exceptional circumstances only, obviously, but I think that's a good thing to put forward to vulnerable families, because I've struggled with that myself. Yeah. And it's very good to have organisations and charities out there all supporting one another.
Yeah.
Yeah.
Oh, wonderful. Thank you very much. Yeah.
Thank you, Osman.
Thank you for having you today. Like I always said, the aims and objectives of these meetings is to engage parents, carers from different communities. So we would really love to see more parents, carers, coming out, asking more questions, because there are a lot of people who can help you on that. Please, if anybody has a question, please just come out and ask the question. That would be absolutely fantastic, honestly speaking. Yeah, so if anybody wants to say something, or before I'm going to pass the floor to Judita, so you can come forward and ask your question, please. Yeah. No one?
Yeah, me, sorry. Hi.
Yeah, no problem, Sarah. You are always welcome, man.
Is it possible that like Family Voice could possibly send me an email with all the links for the support? I know they're on the chat, but it's hard for me to try and get it off. for like the Pinpoint and Roxy's, so that I can try and seek some help and support for myself and my children?
Yeah, that's a good question. I think, yeah, we'll be able to do that. You know, we'll be definitely able to do that because we always had a very good connection with Linda from Pinpoint and Roxy as well. Yeah, yeah, I will make sure that we got that all the information that you need and send it to you.
That's brilliant. Thank you.
Yeah, I will have a word with my boss. I will have a word with my boss, and Judith as well. I will make sure that that information is sent to you. Can you share your email to us, please, Karen, if you don't mind, so that we'll be able to send you whatever you need there. Yeah.
Sorry, can I share what?
Your email address, please.
Yeah, of course I can, if I can get onto it. Thank you.
Yeah, no problem. Any more questions, please? Any more questions? No, like I say, I cannot, you know, I will keep saying sorry, always sorry about that. I always apologize, you know, for you guys about the time because we ran out of time. But I'll make sure that our next session, that will be 1 hour, 30 minutes at least, so that we can cover whatever we want to cover. So yeah, yeah. For the meantime, if anybody wants to leave, you are more than okay to do so. Yeah. Can I have Judith to come forward, please? Judith, if you have something to say. I think Karen, I got your email. Yeah. Thank you, Karen. Yeah.
So I would like to say thank you very much to all our participants. First of all, to our speakers for their very useful and informative representations. Thanks to all representatives of their services providers. Thanks to community leaders. Thanks to parent carriers. Thanks to our partners and our supporters. Thanks to each one who attended that meeting. Thank you very much for all your support and contribution to that session. And just a reminder that the recorded video of that session will be accessible at Family Voice Peterborough Facebook page very soon. And for those who couldn't attend and for those who had to leave earlier, and also we would like you to come back to us with a feedback, or you can leave the feedback now in a chat, because it's very important to improve the quality of our sessions for future. Another thing, we would like to ask you to come back to us by email with suggestions of what kind of the topics for the sessions you would like us to cover in the future. We want to know what do you think, what it is important to you, what would be the main issues you would like us to discuss in the upcoming sessions. Please feel free to contact us with your suggestions by email. And many thanks to all of you, to your time, and we will let you know about the upcoming sessions very soon. Thank you very much to each one and to everyone. Thank you.
Oh, Judith, a wonderful message. Thank you very much. And also thank you, everyone. I hope we all learn a lot from this session. So like Judith said, your feedbacks will help us improve more. So they are very important to us. If anywhere you think that we can improve, just, drop your suggestion or your opinions on the chat box, or you can just email us. Yeah, definitely. Yeah. That will be absolutely fantastic for us. Yeah, like I said, now the session is over, and thank you very much. If anybody has anything to say now, before I can let anybody go, just come forward and do it. Otherwise, we can all go. Yeah.
Thank you.
Thank you very much, Rabo. Thank you. Rabo, can you share that information with Judith, please, so that I can have it? Yeah. Yeah,
of course.
Yes. The slides here, they are very important, honestly, and I think we can, share that one with other parents, carers who was not able to, or who are not able to attend our meeting today.
Yes.
Yeah.
Okay. Yes.
Yeah. Please. Yeah. Thank you very much.
Thank you for everybody.
Yeah.
Have a good afternoon.
Thank you, everyone.
Bye.
Yeah, we will communicate with you next month about our next upcoming meeting. Yeah. Yeah. And
Thank you. Take care.
We would love to have all of you there. Yeah. Thank you, Tanya. Tanya, thank you very much for having me today. Yeah. Thank you. Thank you.
Bye.
Thank you very much. Bye-bye. Thank you. Thank you, everyone. Cheers.
Thank you. Bye.
Bye. Bye, Karen. Thank you. I will share the information with you. I will make sure that Judith will send you an email, all the information that you need here.